This is Dr. Justina Agnieszka Chevalier. As you can see, Julio and Pancho brought some wood. It's huge, chopped, you know. I'm kidding, obviously. Men in my life are like little Twinkies. Usually they require a saving or remedial action and wooing. That's why I prefer to be alone. Second is discussed in the book Getting Married, actually, which is less funny because normally women, we are brought up to be pursued by men who are supposed to be impressive, and that I've already discussed it a little bit, and it's wonderful. However, when we are faced with non-selective survival tasks, some women, we have more burden. Now, my brother, for instance, left because he was 15 years older quite soon, and so I was the one defending my mother because my mother and my father were not getting along. Though they were not towards me in any way aggressive, and it was quite a burden, and that was also a physical work. And my mother many times would tell me that I have no right to be outside of household because she's not safe there. And so that was how I learned to mediate when I was 3 or 4 years old. And men started to seem to me when they would pursue letters or bring me flowers or gifts, like a joke, older or younger, usually trying to uh, have me defend them also in situations of outside words and things like that. And so that's how I ended up pursuing a career in human rights and also in medicine. That is because the outcome for my father was unsuccessful, and for the marriage of my mother and father, my mother was happy afterwards. She was happily married. She married quickly, prematurely so, to a much older person, and she sometimes would voice that she was forced to do so and did not have enough time alone, and so blaming me, of course. And you see, that reversal of roles grew old. So sometimes it is, especially from women who grew up in different circumstances, not known to many, and it has to be revealed and explained. Persons who we work later on hand or arm by arm with men in medicine or from trainings or in also human rights or in other, well, also physical tasks. In non-selective survival, I don't discriminate. When something needs to be done, it needs to be done. It does not mean that my education goes away. It just means that it is to my best interest, and the same is for all other persons, right? Work is not a privilege per se. Work is something that we don't want to do if we don't have to. We prefer to rest, all of us, and when we can actually do it, we do so because it's beneficial to us, and that is what actually I don't know, a few, I don't know how many miles away from Kelso, because in Kelso, when I was dropped off once because a person saved me from a forest with a foot injury, I was unable to walk in the rain. I'm very grateful. It was the first person that saved me when I was actually in such dire need of being taken out of that forest. Unable to walk, it's very different than being cold or things that are milder. And so that then when I was drinking coffee, a woman bought me a pancake. A very nice person. In a Danish restaurant, some person approached and said, "Well, we need work to be done, so why don't you apply?" And so that's why I'm here. Maybe there is something to do, and maybe also what I am doing will result useful. And so here, before I go further into detail, chapter 13 and 14 of non-selective survival, I want you to know, in men or women in relationships in which you were provided safety and well-being that is maximum by both parents, and men needed to compete from the beginning, especially for women, with high standard of a father or older brother, and also such males that you would say you were able to discriminate women based on how they were in comparison with sisters or mothers. That kind of is a luxury, and that luxury falls apart when that person has a unilateral approach and treats you a little bit in a protective way to shield from what's going on at work. And so that person usually provides for you, like I did, safety, and spares all the trauma and information in detail of what's going on in hospital, what's going on in personal life that could traumatize persons. We, like my mom, for instance, my mom would faint, think, bloody finger. We spare that person we are married to, and I was married for 12 years, that information, and provide safety and well-being for that person as if it was a child. And then when we are actually in a situation where we are facing own mortality or risk of no freedom from persistent pain or in lack of safety, for instance, that person is not in a marriage, not the one to turn to, and visibly not concerned with own safety, but expects, as if a child, that self will again provide the same and will shield. And so when you were brought up like I was in such circumstance that you were feeling in the role of a parent for one of the parents that was brought up in different times, for instance, then you kind of have the same as I problem that you most of the time by women, because I'm a woman, who are treated like that, like a maiden or a princess by a husband, you are talked to as a child, which brings strong resentment, rejection, as if somebody was demeaning you when title is skipped or a person says, "Oh, honey, why are you alone?" This kind of thing, or men who approach and do the same and try to see self as superior, you see, while not being superior, because when it is a true superiority, it actually is welcomed. However, or equality, you see, because it relieves. But see, the problem with that is when the marriage is such that you face your own mortality or situations that require you for you to be safe, and that person, as if a child, hides behind. I even had a dog like that, when there was a ring at the door, the dog would hide behind me, see, because that's how I wanted it that's how I accustomed my family to be, right? But the problem with that is that then the situation is such that you are being killed, or you face your own mortality in pain, and the spouse is the one who organizes it or expects you to provide for that person, for self and for others, for person's respect and for self, some sort of adoration and explanations in tears, as opposed to helping you. And that then contrasted with sometimes a co-worker or a person you trained with, be it police, military, or a physician. Often physicians were like that. It brings a person, or nurses also, who seemed tough or bad, or very cold, to a role in which that person is visibly concerned with your well-being when it is appropriate and is able to assist it. And then that creates that relationship that is false, meaning whenever you have a trouble, you seek company of somebody else. Whenever you speak honestly about self and problems at work, such as injuries of others or life or death decisions, such as being in pain or contrasted with some things that you cannot decide on, that suppose as if a child is skipped, and you provide loving, because that is love, loving kindness to that spouse, well-being and safety and material goods. However, a dear intimate relationship, mind relationship, is with someone else. And then many ask, so is that a real marriage? And the answer to that, it is possible to answer. I put it in Getting Married book. It is not. It has to be mutual, meaning if that spouse at least once does not visibly exceed in resentment, that you do not pursue luxury or sexual adoration, your well-being when you are dying or in pain, and somebody else does, and that is a stranger, then the contrast between a stranger and such spouse places that stranger or a friend in the role of a spouse, and that spouse in the role of a contempted upon person that you want to separate from, and that is regardless of sexuality. So no matter then, ladies and gentlemen, what you have done to yourself, how many plastic surgeries you had, and how good you are in fact as a lover, or how well of a cook you are, it turns out that the person who is butch and ugly, and that simply was called a few times when you were working and helped you, for instance, with shooting mafia or things like that, that person is in anxiety when you are harmed, and helps you or replaces you bravely, protects you, while the spouse does not want to listen about it, or does not know about it, or actually calls you a liar or a coward, or being vain in some ways. And that is not often it's called matriarchal relationship. That is not a relationship that is real. We can sustain those relationships for years, but in fact those relationships sexually are not compatible even if sex takes place, because in mind we live the double life in which that mind separates that person as if it was a trophy to dearest, adored, separated from a lot of suffering. A person sometimes pursues suicide because you want to live, but and feeling bad about it, but at the same time has a relationship that is often asexual, or the sexuality is some sort of degrading guilt, a relationship with someone who actually wishes you to be alive and well, visibly so. And so that cannot be a happy marriage, and there needs to be reciprocity in both pursuit of survival and well-being of a woman towards a man towards a woman, and pursuit then also of sexuality that is mutual, in which intensity maximum one is associated with procreation, while babies not necessarily have to be pursued. And so those two are, when you are in pain, the difference between who you're gonna call on deathbed or in danger, and who you're gonna skip and then laugh at the table, or arrogantly omit, and then in resentment will do the same. And so that it takes me back to thriving. The thriving, the two on a given area, to add to, because I wanted to finish that report, that epidemiologic report that I believe Dow freaking made me do in Malibu, needs to add things that I placed in notes to people that live there. In the United States, the main problem with persons is that persons are proud and don't respond to or don't listen to providing things and kindness, or upset and arrogant, and think that the offering own death and the miss in exchange is a rewarding or wanted, and that is false, and especially from the standpoint of the fact that I use that highway and everybody else, does. So in this video series I'm gonna add things that I've done in the United States during my trip that were ignored in reports as well. And so where's my lighter? In the United States, the next problem, apart from I mentioned rain, cables that need to go underground, fuses, boxes that need to be changed, the rain that needs to be examined, not water where the fishes are, with another label, do not destroy nature, a few $1 million project, but what is in the air that makes grass catching sparkles, and emissions from engines that need to be set up on settings, on less tolerant in cars also in that area, and perhaps in many other places in the United States. The next thing is, those are ashtrays. Across all of these, I know that it is compelling to say that smoking is bad and place no smoking all over. Persons smoke, that is the fact. And persons throw those cigarette butts all over highways and sites. And see, I then, like a big monster, feel compelled to eat them almost, because they are dangerous. And many others do so, because I've seen them. And the thing is that placing an ashtray, there are many artists in that area. Like in Netherlands, is a must. In each and every stop, next to that theater that is on that Malibu, and in every place, there needs to be an ashtray so that persons can discard those, the same as big dumpster containers. I think that I'm exhausting time. Yes, so that's the point. Apart from the previous factors, so that the spontaneous fires are resolved once and for all, do not occur every 5 years anymore.